Hello, Mrs. Smith. How are you doing today?
I'm good.
That's good. So I understand you had a fall a couple months ago, and you have some chronic edema afterwards. Is that true?
Yes.
All right. So let's go ahead and take a look at the leg first. Now, during all this treatment, I'm going to be doing some manual therapy. So if I put my hands on you.
Yes.
Okay. So first off, it is a bit swollen. We do want to work on that. Is there any pain with that swelling?
Yes.
Okay. So for that pain, from 0 to 10, what would you say your ratings are?
4 resting and 7 when I'm moving.
Okay. So we'll try and work on that too. Try to make it help with that pain so it doesn't hurt as much when you're using it specifically. And we're also going to try and decrease that swelling. During this treatment, I'm going to be doing some stroking, which is going to be just some basic touch, working the leg, try to feel out the tissues, and you get used to my touch. And I'm also going to be doing some effleurage, which is going to be a bit more pressure. It's going to be really pushing down those muscles to help move the fluids and try to decrease that swelling. Okay?
Okay.
All right. So first off, do you have any congestive heart failure history? Any history of cancer?
No.
Any lacerations or wounds? That's a no. There's no infection either, so I think we are good to go. I'm going to be using some lotion. Is there any other? Do you have any allergies to the lotions?
No.
For this, I didn't have any unscented or more massage-oriented lotions. We just have some Nivea Cherry Blossom. We'll be using that. Right. I'm going to go ahead and warm up the lotion on my hands first so it doesn't be too cold when it hits. You might still feel a little bit. Bear with me. We're also going to tuck these sheets in a little more so they don't affect your clothing at all. And put this sheet underneath the leg. So, okay, if I lift your leg? So we don't get it on the pillows here. Just use that. Alright, so I'm going to start with the stroking technique right now. So I'm just going to be going up and down the leg. Spreading out the lotion. Feel okay?
Mm-hmm.
Okay. Alright, so for the pain too, this will be activating the gate control theory, which more or less it's using a non-painful stimulus or touch that your nerves can sense that will be blocking out the painful senses that are going through. And by this I mean, so if we want to go to a more technical level for our video, it's going to be the A beta fibers, which are the non-nociceptive, so non-painful stimulus sensory organ or sensory nerves that are going to be sending signals that go quite a bit faster than the C fibers and the A delta fibers that are the painful stimulus. And that's going to be blocking out the signals at the spine before they can reach the brain. How does that feel?
It's okay.
Yeah. I'm only doing the stroke in one motion as well because of the edema that you have. So I don't want to bring any fluids back towards the distal end of your limb. So towards your foot. I want to just specifically go proximal towards the main part of your body. Alright, what I'm going to start doing now, after I add a little bit more lotion, is going to be the effleurage technique. So this is the main technique to help reduce that swelling that you have. So it's going to be moving the interstitial fluids, which is the fluids that are released by the blood system, that are just kind of sitting there with the waste, such as little debris, proteins, and other little immobile stuff. that are too large to enter back into the circulatory system. And it'll help filter those at the popliteal area and the inguinal area, which is at the inner thigh. And what happens there is there's a big grouping of lymph nodes in the system right there that are going to kind of just collect it and filter out the debris so we can get those fluids back towards the proximal area, back towards the heart. And the waste will eventually be sent through the system to go to the kidneys. And they will kind of just completely be filtered out and they'll be sent out as urine. So we're going to start specifically right here at the bottom leg of the knee, bottom part below the knee. And that is going to be where we get to that popliteal area. We're going to be just doing a deep pressurized stroke, kind of like a squeegee. And we're going to be just taking a stop of the knee so that the fluids can be collected and the valves can close themselves so the fluid doesn't return. Does that feel okay?
Mm-hmm.
Good. We do want to make sure that some stays above the heart. That'll help that return for the venous flow. Alright, now we're going to start on the thigh. Let me know if you feel any pain or anything. So it's a larger area, I'm going to do some alternating strokes. A little bit. Is that feeling okay, Mrs. Smith?
Mm-hmm.
Good. Alright, we're just going to end this massage with a little bit more of strokes. Just for a good feel. Let's go ahead and wipe off that excess lotion. I'm going to use the sheet because I don't have a towel that we can use. Alright. Back up now. And it does look like that swelling had gone down a little bit after the massage. How would you say your pain's at?
It went down.
Went down? What would you say it was at rest? You said it was a 4 before.
2.
Okay, that's great. And we can't really test it in active right now since you are laying down, but with that 2, we can give you a pretty good sign that that 7 went down as well. Alright, so we're going to go on to our treatments and see how you do with those. Thank you.